Hello, my name is Kim Miller. I'm a lead profitability coach with Inspired Hygiene. I'm a columnist with RDH Magazine as well as a national speaker and author. I'm also the co-founder of PerioFrogs.com. That's frogs with a Z. Be sure to check us out online. So I want to talk with you today about this new article. It's actually an abstract that was printed in JADA 2015, the Journal of the American Dental Association, and it was an abstract, a culmination of the research up to this point. And the title of the article, it's a big mouthful, is Evidence-Based Clinical Practice Guideline on the Non-Surgical Treatment of Chronic Periodontitis by Means of Scaling and Root Planing with or Without Adjuncts. Now, this article is really interesting, and I want to encourage everyone watching this video to look this article up, download the whole thing, and take a look at it. You can get it at jada.org. But here are the questions that they ask. They asked two questions, and I printed them out so I could be sure to give them verbatim to you. Question number one was, in patients with chronic periodontitis, does scaling and root planing with hand instruments or ultrasonics, when compared with no treatment or just a prophylaxis, result in greater improvement of clinical attachment? And the second question was, in patients with chronic periodontitis, does the use of locally delivered antibiotics or antimicrobials, systemic antibiotics, combinations of locally delivered and systemic antibiotic agents for modification of host, or non-surgical lasers as adjuncts to scaling and root planing, compared with scaling and root planing alone, result in a greater improvement for clinical attachment? Well, here's what's interesting. The experts found that there was only, on the average, 0.5 millimeters of attachment gain. Well, that's not very much. Now, in the end, they did all agree that doing nothing was not a good idea, and that offering scaling and root planing actually did give the patient a benefit. But I would like for you watching this video to think with me on this. What about tissue response? What about the absence of active infection? I find it really fascinating that the committee, when they put this research together, or they put the abstract together as a review of the research, that they didn't look at what's happening to the active infection. Do these adjunctive therapies, including laser and antimicrobial, actually help to reduce the active infection in a patient's mouth? So I'm going to ask you that when you read this article to ask a third question. What about tissue response? What about the reduction of active infection? What about the fact that even if we don't get any more than a 0.5 millimeter attachment gain, what about the added benefit from a medical systemic point for the patient to reduce the amount of active infection in their mouth and reduce the bacteria that's dumping into their bloodstream, which is especially important if your patient is a diabetic or has heart disease. So as you review this literature, and it's a great review of the literature, it really spells it out, what we can anticipate in terms of attachment gain. But again, I'm asking you to think differently about this. Don't hinge your results on clinical attachment gain, or reduction of pocket depth. I think that we should be also looking at the reduction of active infection and the elimination of active disease. So consider that.